So we had been testing everybody on campus every 2 weeks as a requirement to be in our campus population. And over the space of several months, in between, fall 2021 and spring of 2022, we had something like 4,000 COVID positive individuals. So we reached out to all of them to find out if they had had prolonged symptoms. Of those, we had a pretty healthy rate of people who came back in. About 1,400 people responded. What we were amazed to find was that 36% of those who responded had had symptoms more than 4 weeks after their initial positive test. Being vaccinated conferred some protection against having prolonged symptoms after COVID, if you may long COVID. Those who were boosted were 2.5 times less likely to have long COVID, and those who had not completed their initial vaccine series were even more likely to have long COVID. We did something called multivariate regression analysis, where we can look separately at factors that sometimes are linked to each other. But when we teased it apart, age was not an important factor in whether or not you had long COVID. Young people are just as likely as older people among our healthy student and working population to have long COVID. Well, I think the public health significance is that even among people who are healthy, fairly young, working people who are actively engaged, either employed or in school, that COVID is a risk. And that not only is there a risk of having the illness, there's a risk of having prolonged symptomatology, and therefore having, if you may, interruptions in your studies, interruptions in work. I think that for employers everywhere, this is of concern,